The flu is a common illness that can make people feel miserable, but in some cases, it can lead to life-threatening complications. While most recover within a week without major issues, there are situations where symptoms become severe, and one of the most dangerous risks is sepsis. Recognizing the warning signs early and seeking immediate medical attention can be life-saving. Sepsis is a condition that occurs when the body's immune system overreacts to an infection, leading to widespread inflammation that can damage vital organs like the lungs, heart, and kidneys. If left untreated, sepsis can cause organ failure and death, making it a true medical emergency that requires urgent care. One of the most alarming aspects of sepsis is how quickly it can escalate. It often starts with an infection, whether from bacteria, viruses, or fungi, that the body struggles to control. In some cases, the flu virus itself can trigger an extreme immune response, or a secondary bacterial infection, such as pneumonia, can develop. This is why the flu should never be taken lightly, particularly in high-risk individuals. While fever, body aches, and fatigue are expected flu symptoms, additional signs such as shortness of breath, a racing heart, confusion, or cold, clammy skin should raise immediate concern. If someone feels sicker than ever before, with symptoms that worsen instead of improve, sepsis could be developing, and medical help should be sought without delay. Certain groups are particularly vulnerable to sepsis. Older adults over 60, pregnant women, newborns, and individuals with chronic conditions such as diabetes, lung disease, liver disease, cancer, or weakened immune systems are at the highest risk. People undergoing treatments that suppress immunity, such as chemotherapy, also need to be especially cautious, because their bodies may not fight infections as effectively. A simple flu can quickly escalate into something far more dangerous. The best way to prevent these complications is to take proactive measures. Vaccination against the flu can significantly reduce the risk of severe illness. Practicing good hygiene, such as frequent hand washing and avoiding close contact with sick individuals, also helps minimize exposure to flu viruses and other infections that can lead to sepsis. If there is any suspicion of sepsis, immediate action is crucial. Symptoms such as severe difficulty breathing, extreme weakness, dizziness, or a sudden change in mental state require urgent evaluation by a healthcare provider. The safest course of action is to call emergency services rather than waiting to see if symptoms improve. Delaying treatment can result in irreversible organ damage or even death. In a medical setting, doctors will typically conduct blood tests, check vital signs, and start treatments such as antibiotics or intravenous fluids if necessary. The key to survival is early intervention, which is why understanding the signs of sepsis and responding quickly can make all the difference. While the flu is a common seasonal illness, it should never be underestimated, especially in individuals who are more vulnerable to complications. Taking preventative steps, staying vigilant for worsening symptoms, and knowing when to seek emergency care can help protect against serious consequences like sepsis. With the right awareness and quick action, the risks associated with flu-related complications can be minimized, ensuring a safer and healthier recovery.